abdominal bracing, engaging your core, stiffening your abdominal muscles, all of that is essential to people who get back pain when they move. Creating a stable base for your spinal column is critical to maintain a neutral spine position and reduce the likelihood that you're going to create movement in areas that are going to fire off some pain, whether that's a disc, whether it's a joint, whether stressing a disc or a joint fires off nerve pain. Doesn't really matter. The ability to control your abdominal musculature is essential. And there's really one way to do it properly, which involves contracting all of the abdominal muscle groups all at once. There's a slightly strange hypothesis about trying to isolate one muscle group, the transversus abdominis, which comes from a bit of research a few years ago that identified that people who have nice strong transversus abdominis muscles experience less back pain than people whose transversus abdominis is a bit weaker. And the extrapolation of that hypothesis, that thought was, that's the muscle that we got to train. Well, reality is you can't isolate that muscle and train it to more than about 5 or 10% of its maximum voluntary power without initiating contraction in your other abdominal muscles anyway. So even if you could find a way to isolate it, you can't really train it without engaging the other muscles anyway. And those other muscles, they crisscross one another. The fibers of the muscles crisscross one another, a bit like carbon fiber weave. And carbon fiber, as we know, when it's constructed for a particular purpose, has lightness but incredible stiffness. And that's what you want these muscles to provide. Not a dirty word, stiffness, in terms of your lower back. You want that base of the column of your spine to be stable. It's core stability after all. That's what you're going for, is core stability with these exercises. So to get core stability, to get a strong core, you have to learn how to engage muscles the right way. What does that feel like? What does that look like? So a lot of the time I'll teach people to do it here on the table, lying down. So first thing to do, whether you've got knees bent or knees straight, is to figure out where your comfortable neutral position is. So that usually is a little hollow shape in your lower back, somewhere between all the way flattened to the floor or all the way lifted and extended away from the floor. So somewhere in the middle there is going to be your comfortable sweet spot, and that's your neutral. So you're going to maintain that. Sometimes it's nice to keep your hand, the back of the hand, in that area, supporting it, and also observing whether you try to move out of that position. Don't move out of that position. Find your neutral, maintain that neutral position. Some people will teach you to pin your spine onto the ground. Never do that. There's no reason, no good reason to do that. You should be able to maintain your neutral and brace these muscles completely independently of any movement of your spine. So find your neutral, support it, and put a finger or a thumb into your abdominal muscle just about 5 centimeters a couple of inches to the side of your belly button, and relax and just feel the tension there. Now, with your fingers just slightly poked into your belly, cough. And you'll find that your fingers or your thumb gets pushed outwards. What's pushing your fingers outwards are your abdominal muscles. That's it. Those are the muscles that you're going to use to engage your core. So that's what you want to replicate. You're not sucking in. Almost everybody, when I say stiffen these muscles, sucks in. Now watch what happens to my fingers when I do that. They sink further into my belly, and I can still keep pushing down towards the floor, towards the table. There's no engagement of those muscles. There's no stiffness. There's no support. There's no stability from that sucking in, trying to hollow. That's not what engagement of your core is about. It's about bracing with all of the muscles all at once, such as you would do if you coughed. It's a forced exhalation that will get those muscles contracting. What happens when I tell people cough and they feel it, they feel that engagement of the muscle, usually what they then do is they laugh, they go and again what they feel is their muscles pushing out against their fingers, because again that is a forced exhalation. So pushing my fingers away with my abdominal muscles, creating stiffness. You know, if somebody dropped a bowling ball on my belly, I wouldn't suck in, I would stiffen, tighten, push out against that load. The analogy I use with patients: you're in Africa, you're lying on the ground, enjoying the sunshine. An elephant walks towards you. Why you don't get up and run away, I don't know. Elephant walks towards you. It hasn't seen, it's about to step on your belly. What would you do? What would you do to protect yourself? You would push up against that force about to squash you into the ground. And you'd use these muscles to brace. That's abdominal bracing. Nothing else will give you the stiffness, stability, protection in this area more than that. When you've got these muscles braced, you can move your ball and socket joints of your hips from a stable, anchored center. All of the load involved in that is being taken through my abdominal musculature along with the muscles of the hips. Bracing allows you to turn your shoulders and your hips at the same time, because you're not flexible in the middle. That's abdominal bracing. That's how to engage core stability.